Well, good evening, everybody. I'd like to reconvene the State Government Finance and Elections Committee. Again, we are reconvening from this morning. We have one bill on the calendar remaining for today, House File 1200, Paid Family and Medical Leave. Representative Richardson is here with us today. I'll move Representative Richardson's bill before the committee. I do see that we have an author's amendment, the A21. Representative Richardson, if you would like to describe the amendment, or if you prefer, I see we have Ms. Marta James also available, if you would prefer her to summarize the amendment. Representative Richardson.
Thank you, Mr. Chair. If Ms. James could summarize the amendment, that would be perfect. Thank you.
Great. Ms. James, to the A21 amendment.
Thank you, Mr. Chair and members. This is a technical amendment. It adds several cross-references to the bill, and then it also adds definitions and clarifying language to specify which account the bill is referring to. So just makes a couple technical changes.
Okay. Any questions on the A21 amendment? Give everybody a second here. I'm not seeing any hands. Any questions on the A21 amendment? All those in favor of the A21 amendment say aye. Aye.
Aye.
All those opposed say no. Okay. The motion prevails and the amendment is adopted. We do have the bill before us now. Representative Richardson, would you please present your bill?
Thank you, Mr. Chair. House File 1200 would create a paid family and medical leave insurance benefit program administered by the Department of Employment and Economic Development. The program is modeled after our state unemployment insurance benefit program and would provide a much needed safety net for families in order to be able to take time for critical bonding with new children, and would also allow workers access to comprehensive leave to care for themselves or a family member. At some point, the majority of workers will need to take some time away from work to care for a new child, a family member that is sick, or to recover themselves. Caring for others and receiving care is a key component of being human and living a fulfilling life. Unfortunately, the reality for many Minnesotans is it's not that simple. In the midst of the COVID pandemic, it has become even more clear that illness can strike at any time, and for workers without paid leave benefits, individuals are too often left with the impossible choice of choosing between caring for themselves, a loved one, or a paycheck. COVID has shown a spotlight on our society's inequities and also highlighted the strength of paid family and medical leave programs. Paid family leave is a bipartisan issue, and other states have implemented programs that provide important lessons learned. The first policy was passed in 2002, and with subsequent states adopting paid family and medical leave policies, there's a roadmap that helped to shape this bill. In fact, our bill takes a number of elements from the Washington State Paid Family Medical Leave Bill that passed with bipartisan support in July of 2017. Washington State began to pay out benefits in January 2020, confronted with the full force of the COVID pandemic. They processed more applications than expected, but the fund remained solvent, and payroll premiums will remain flat for 2021. Paid family and medical leave done well is a considerable contributor to statewide efforts to promote equitable growth. Today, I have a number of testifiers on behalf of this bill, and the chair, I would request that you recognize Deborah Fitzpatrick to provide a quick walkthrough of the relevant portions for the committee.
Wonderful. Thank you, Representative Richardson. Deb Fitzpatrick was the first testifier.
Hi. Good evening, Chair Carlson, Chair Carlson, sorry, members of the committee. My name is Deborah Fitzpatrick. I have a few slides that I'd like to share for this walkthrough, so I'm going to share my screen. And wanted to just highlight that I am here today as the Director of Policy at Children's Defense Fund Minnesota, but I'm presenting also from my past role at the University of Minnesota Humphrey School of Public Affairs, where I led the research team that conducted Minnesota's legislatively mandated design and implementation study for the state. I wanted to take just a few minutes, excuse me, can't move the slides here. Wanted to, hang on, sorry about that. Oh my goodness, okay, sorry, apologies, okay. So wanted to take just a few minutes to kind of go over the structure of the program at a high level and can take some detailed questions later. House File 1200 is structured as a contributory social insurance program. This is the dominant and successful model in 8 US states and most countries around the world. So what does that mean? It means that most employers and workers contribute to a state fund based on their wages. For an average median worker in Minnesota earning $52,000 a year, that would be about $3 that's contributed on behalf of the employer and the employee. The few exceptions are employers that offer comparable benefits, and those employers can provide their own benefit program. And self-employed workers who are eligible to join the program if they choose. Eligibility for the program is based on attachment to the workforce and on their earnings, plus the need for an eligible leave. And finally, healthcare providers certify that need for leave, and then workers make a claim on the state fund. And that state fund then is providing that support to the workers while they're on leave. As Representative Richardson already mentioned, House File 1200 builds on many unemployment insurance definitions and processes to reduce the employer burdens, as well as to help ensure a successful build out of a new state program. So I'm gonna apologize. Okay, sorry about this. I got some technical challenges here. What is going on? Sorry. I'm going to just open it. This is a PowerPoint instead. I apologize for the technical challenges. All right. Apologies, it's still not advancing. So, slideshow.
You're stuck on slide 1, huh?
I am. I'm sorry.
That's okay. I mean, if you can walk us through them.
Yeah. Okay. Sorry. I'm sorry. All right. So the program, I'm just going to kind of do at a high level the benefits structure so that the committee is aware of that. Up to 12 weeks per year for a worker's own serious health condition, and up to 12 weeks per year for the care of a family member. It's important to note that data from the U.S. Department of Labor and many other state programs, as Representative Richardson mentioned, have a track record over time that shows us that most workers often use fewer weeks than the maximum allowed, and the vast majority of workers use the program for only one leave over multiple years. Now I wanted to turn for a moment to the pieces of the bill that are relevant to this committee's jurisdiction. The first is the state as an employer, and wanted to call attention to Section 6, where the definitions for covered employment, the state of, the employer and employee are laid out. Lines are mentioned here. The state of Minnesota would be an employer and most of its workforce employees under these definitions. So as an employer, the state would be treated as any other employer, contributing to the trust fund on behalf of itself and its workers, and providing notice and leave with employment protections to workers eligible for benefits under the program. State workers would then, as we've talked about already, receive the wage replacement from the state fund during their leave. Now, the state could also, like any other employer, alternatively choose to substitute a comparable private plan or their own plan and under that circumstance would no longer contribute to the state fund. It would make other arrangements to provide benefits equal to or better than those available through the state program. Wanted to speak for just a minute about the elements of the bill that address collective bargaining. Those are included on page 62.21. Basically, the benefit program is viewed as a floor for future collective bargaining agreements. Nothing in the bill limits the parties in a collective bargaining agreement from bargaining for other elements, but the bill, the benefits that are laid out in this bill would be the floor. Just briefly wanted to touch on some of the appropriations that also are in the jurisdiction of this committee. And as there are members of the MMB staff online as well to answer additional questions later, but those begin at line 67.22. It's important to note that the appropriations in the bill assume that the state as an employer is participating in the state program as opposed to offering its own program. So just touch on a couple here, but wanted to call out the largest ongoing general fund implication or appropriation is for the premiums for state workers. So again, as mentioned earlier, employers and employees split the premium. This appropriation starting on line 67.22 is for the 1.9 million and then moving on to 3.7 after the first year of premium collections is for those premiums for state workers. There's also a small appropriation for the Legislative Coordinating Commission. MMB might be able to answer more questions about this, but my understanding is that most of the legislature would be covered under the costs to upgrade the system that were in the previous slide for MMB, but there's the House, I guess, is outside of that system. So there's a small need for funding to cover those expenses. And then finally, just wanted to call out that, of course, this bill does create a new deed division and a trust fund. The Family and Medical Benefit Insurance Division, that is created in deed is there to administer and operate the program. And finally, the account is created as a special revenue fund in the state treasury. This fund, then the premiums are deposited in this fund, and those funds are then used to pay benefits under and to administer the program. I think it's important to note that the program is designed to be self-funded so that after the initial year of state funding that is in the bill, all of the costs associated with the program, other than those premiums, again, for the state workers, would be covered under the premiums that are collected and would come from the trust fund. And also the bill does have those funds that are in fiscal year 22 being paid back by the trust fund in subsequent years once revenue is being collected. So with that, I'll stop, and just also somebody from D, Darielle Dannen, is here as well to answer questions or share details on appropriations, startup, and program administration within the deed appropriations of the bill. So I'll stop there and apologize again for all the time.
No problem. Thank you, Ms. Fitzpatrick. Very much appreciated. The slides were helpful. Representative Nash, I see you have your hand up. We have multiple testifiers.
No, I just wanted to be first on the list, Mr. Chair.
All right. That's what I like to hear. Okay. Next, Representative Richardson, I have a Kimberly Lewis next. Is that next on your list?
Yes.
Wonderful. Ms. Lewis, if you could please proceed with your testimony, or introduce yourself to the committee and proceed with your testimony.
Good evening, Mr. Chair and members of the committee. My name is Kimberly Lewis. I am with the Minnesota School Boards Association. We represent all 333 school boards across Minnesota. And tonight as well, I'm speaking on behalf of the Minnesota Association of School Administrators, the Association of Metropolitan School Districts, and the Minnesota Association of School Business Officials. We appreciate the opportunity to share some initial thoughts on House File 1200. We have not had the opportunity to meet directly with Chair Richardson, but we hope to do that soon, and we look forward to learning more about this bill as it moves through. Our boards, administration, and particularly our school district business officials and human resource representatives have some questions and concerns as it relates to the implementation and management of the proposal. As with last year's House File 5, our school district business officials and HR reps have alerted us to three main concerns or questions that I'd like to share with you this evening. Our primary concern is the cost to school districts. School boards do not have the authority to levy for the funds that would be needed to cover the employee portion of this proposal. In addition, when employees are out, districts must hire a sub. That's another cost, a direct cost to the outcome of the bill. Since we don't produce a project such as widgets or what have you, we can't increase our price per se. So the funds would need to come out of the general fund, in other words, the classrooms. There is a soft cost also to the administration and reporting of the program at a district level. And at a time when most schools in Minnesota are experiencing budget deficits and making cuts, especially in the midst of this pandemic, we are concerned about how we would pay for this. Another question is how it would relate to collective bargaining and how that would be impacted, if you will. If passed, would this statewide benefit be a part of the local bargaining negotiations? And I think I heard the previous testifier mention that briefly. Or would it supersede the negotiations, or both? And then how would this align with currently negotiated paid time off in our collective bargaining agreements? For instance, our teachers' collective bargaining agreement we're right in the middle of that right now. So the July 1st implementation date could be problematic or something to be considered at this point. And finally, due to the nature of the workforce that we have within our school districts, there would be a potential for a greater need for the number of substitutes. Employees could potentially be out of the classroom for up to 24 weeks of the school year, or longer if they were to also use their accrued sick and vacation time in addition to this leave. If that were the case, our HR reps who struggle now to hire subs wonder how would an adequate number of highly qualified substitute teachers be available and other support professionals to be secured when they are already in such short supply. It's our responsibility to keep continuity in the classroom and with a highly qualified teacher or other personnel in front of our students at all times. We plan to continue discussions, and with both our district personnel and Representative Richardson, we look forward to that, and we appreciate the committee's time this evening and listening to our concerns. And with that, I will stand for any questions.
Thank you, Ms. Dunn-Lewis. Appreciate your testimony today. Next, in terms of testifiers, I have Jessica Peterson White is next on my list.
Thank you. Thank you, Mr. Chair and members. I am Jessica Peterson White. I own Content Bookstore, and I serve on the Northfield City Council, and I'm also a member of the Main Street Alliance. When my son Thorsten was born in 2016, I budgeted at my shop to have about a month at home, and then I eased back into work, and it was expensive to cover all of my hours. So I spent a lot of days and nights with a baby and a laptop in my arms, or with the little guy napping behind the counter. Lyra, my third child, was born early last March, and while I planned carefully so that I could be home with her for 10 weeks, it didn't work out that way. Because of the pandemic, my maternity leave lasted a little more than a week, and then I was working harder than ever before to make sure my bookstore survived 2020. Self-employment has given me flexibility, but I've made painful trade-offs between investing in my business and caring for my babies. In 2018, the city of Northfield passed a 6-week paid leave policy for our employees. That's paid family leave and paid medical leave. We heard many stories of similarly terrible choices for our city employees we're facing, and all of these stories represent costs, existing costs, often in replacing staff, but also in morale when people are forced to choose between what's best for their families and their jobs. We're proud of our policy at the city, but it's not enough, and unpredictability is our biggest constraint. It's hard to budget because our pool is small. It just makes sense to ask employers and employees to contribute to a statewide fund, which would benefit everyone when they need it and protect us all from big variations in costs. Statewide paid leave insurance would also mean that Content and the city of Northfield could compete with larger employers by offering comparable benefits. And it would ensure that when one of my 12 employees has a new child or an illness or a sick loved one, they could care for their families and return ready to work while my business had the resources to cover their responsibilities. It would make my business stronger and more resilient. I don't think anyone believes babies should go to daycare 2 or 6 weeks after they're born, or that it's humane to force a new mom back to work at that point either. But if we're not choosing to provide a system that keeps family income steady during those precious early months, we're pretending that that is realistic, or we're pretending that working parents can afford to skip a few paychecks. Every single city employee, every Content Bookstore employee has a family counting on them to be a caregiver at least sometimes, and to be breadwinners too. Nobody should have to choose between the well-being of their child and their job. Please support a paid family leave system. Support House Bill 1200 to ensure that all families get a healthy and secure start. Thank you.
Thank you, Ms. Peterson-White. Appreciate your testimony. Next on the testifier list, I have Angela Byrne. Is Angela on the call? Angela, if you could introduce yourself and proceed with your testimony.
Yes, sure. Yes, sir. Good evening, members. My name is Angela Byrne, and I'm a proud state employee and MAPE member from Roseville. In February 2016, at age 31, with a 16-month-old toddler, I was thrust into the sandwich generation in the worst way. My mother, Robin, was diagnosed with stage 3 cancer and a sepsis infection that nearly killed her. I had little paid accrued leave after my maternity leave, so I applied for FMLA and moved in with mom. After I returned to work from FMLA, the responsibilities continued throughout 2016 and 2017 with seemingly endless follow-ups, tests, medications, plus repeat hospitalizations. And that doesn't count all of the time fighting with multiple insurances and Social Security disability determination services. The nightmare ultimately ended after my 3rd FMLA and a 2nd round of treatment that left her weak enough to succumb to pneumonia on February 11th, 2018. She was 57. To add to the cruelty of the situation, after my bereavement, I was out of FMLA and accrued paid time off to handle her final arrangements. I took leave as I accrued it, but almost all of the time I spent caring for mom and then her estate for those 3 years was unpaid. The stress of caretaking and her death left my mental health in shambles. I have been in and out of work since, again, with mostly unpaid leave. I have not received a full annual salary since 2013. In addition to my lost wages, I have sacrificed a non-trivial amount of my retirement. My husband and I are extraordinarily fortunate that we could weather this storm without completely destroying our long-term financial health. However, I am painfully aware that this isn't true for so many families. My mom was one of those people. She went back to work just 2 weeks after giving birth to me because she would be fired if she took more time off than that. I sit before you tonight, almost 2 years to the day since I last spoke to this body on paid family and medical leave, in the same month as the 3rd anniversary of my mom's death. 35 years after she returned to work, still broken and bleeding from childbirth. I ask you, how much longer do we have to wait for this program? Thank you very much for your time tonight.
Thank you, Ms. Byrne, for sharing your story. I agree. There's unfortunately a lot of families that can definitely relate. So thank you for being with us today. Next, for testifiers, I have Justin Aurelius. Is Justin on the call? And Justin, if you can introduce yourself and proceed with your testimony.
Hi, members. Good evening, Mr. Chair and committee members. My name is Justin Aurelius, and my wife and I both work for the state of Minnesota community-based services. She would have liked to have been here tonight, but she was unable to attend due to she is working. I'm currently working, so I'm stepped off the floor right now. I live in Granite Falls, Minnesota, and I help community members with disabilities to live more independent lives. I'm a member of AFSCME Local 701. I'm here to testify in support of House File 1200, paid family medical leave. I think every worker should be afforded the time to care for their loved ones in a time of need. This is about our society recognizing the value of that care. When my wife and I had our first child, I was one of the workers that did not have much paid leave, unfortunately. My wife, Amanda, had a C-section and I had to go back to work within just 10 short days. She was alone with our baby, adjusting to a brand new life at home and recovering from a major operation for several weeks. And for me, leaving our family each day was really hard to do. I was located an hour and a half away from home. It was emotionally really difficult because I wanted to be by my family's side. It was hard for me. I can imagine it was even harder for her. Also, it was a financial challenge too. And at one point, we actually had to move in with my mom due to everything that had happened. Luckily, when we had our second child, we both had access to paid parental leave. It was a benefit our union helped negotiate for state employees. At the time, I recall feeling like we were lucky that we had won the lottery. It allowed us both to live a life that we weren't afforded with our first child. But why does it have to be that way? Why should new parents feel like lottery winners for spending time with a newborn baby? Shouldn't that be an expectation of new parents? Our society should put a higher value on caring for loved ones. We should have a system where people don't have to choose between a paycheck and caring for their family. I believe in personal responsibility and I believe in working hard. I also believe that when we pull together and care for one another, we're more connected and we're stronger and healthier for that. My last thoughts are, working parents need paid family leave personally because it just put us in a situation financially where we could just feel free and it just helped us out. So hope you guys can recognize that and I appreciate your time. Thank you guys.
Thank you, Mr. Aurelius. We appreciate your time as well. Thank you for being with us today. Next testifier, I have Kate Davenport. Kate, if you could introduce yourself and proceed with your testimony.
Thanks, Mr. Chair and members. My name is Kate Davenport. I'm one of the co-presidents of Eureka Recycling based here in Minneapolis. We're an enterprise with approximately 100 employees and also a member of Main Street Alliance. Like other small businesses, the last year of the pandemic has been challenging. We've operated at full capacity the whole time as we provide a vital service of recycling collection and sorting to communities throughout the state. Of the 120 of us, less than 10 are able to work from home full time. The rest of our team have positions that require them to be on the front line, driving trucks, fixing equipment, and sorting recycling. We were really grateful that Congress provided small businesses the ability to provide paid family and medical leave as part of the Families First Act for COVID relief adopted last spring. It helped us to meet our responsibility to our employees and to the public health by providing tax credits to businesses that could continue to pay employees when they were sick with COVID, had to quarantine or care for their children. We've always provided paid time off and paid sick time for our staff, and it's been a key benefit to the culture and resiliency of our organization. However, the pandemic revealed that there are times when employees needed more paid time off than we provided. The coverage of COVID-related sick time and paid time off was vital in preventing a widespread infection throughout the staff and keeping us operating. No one should have to choose between staying healthy and getting their paycheck, especially during this global pandemic, which has revealed that. The largest challenges with the program, the FFCRA, has been that it limits each employee to 80 hours of medical leave, and that it's only for COVID-related absences. We decided to cover any time over the 80 hours for COVID-related issues outside of our normal PTO structure to ensure that staff felt supported and that they stayed home. This was a worthwhile investment of tens of thousands of dollars, but is not something that most small businesses could afford to do. This past year showed us that something like paid family medical leave, which you're considering, would actually allow our staff to access these kind of benefits at a lower cost than what we have taken on ourselves over this last year. Establishing a paid family and medical leave system through the state is really what will help the small business community. It helps level the playing field for small businesses in attracting and retaining employees, as larger employees can often provide the benefit of extended paid leave, but small businesses can't. Again, the cost to a small business to pay into paid leave, like you're considering, is less than covering this cost ourselves and helps us retain talent and skills. So I really encourage you to support this program. I think it's a really vital investment, so please support it.
Thank you, Ms. Davenport. Appreciate your testimony today. Thank you for being with us. The last testifier on the list is Ms. Amy Eggert. Amy, if you could introduce yourself and proceed with your testimony.
Hello, good evening. My name is Amy Eggert, and thank you very much for having me here tonight to speak. I speak on behalf of Isaiah. I'm a college professor at Southern New Hampshire University, and I teach business courses. I believe paid family and medical leave is essential for Minnesota families. When I was pregnant with my first child, I applied for short-term disability through my employer. And because of my pre-existing condition, I was denied. My challenges were many: migraines, bed rest, a premature baby with jaundice, postpartum depression, an infection the first week after delivery, and a major surgery 6 weeks after delivery. I was fortunate to have support systems that other families did not have, a loving family that supported us. Therefore, I was able to take the full 12 weeks to care for and bond with my baby, recover, and go back to work for my employer. Yes, I did have my mother help me with the house so I could be the best mom to an infant that I could be with the challenges I had. Now, some people say that is what new moms should do, rely on family and friends. But what about mothers that do not have a safety net of family and friends? As the Family Medical Leave Act coordinator at my workplace for a company with several thousand employees, I was always stunned to talk to mothers who couldn't afford to take time off for medical leave after having a child. Usually these were single moms, and they didn't have a choice. Oftentimes, when people have infants or children and they have to work and they don't know what's going on with their children, they're not really at work 100%. You know what I mean? So paid family and medical leave makes it possible for moms and dads in Minnesota across race, class, and geography to not worry about where their next meal is coming from and how to pay the bills. They can go to work and they're at work. So they can lovingly bond with their newborns. It also levels the playing field for small businesses with the large corporations that already offer this benefit. Paid family and medical leave will help get the newest Minnesotans off in a stronger, safer, and healthier direction. Thank you very much.
Thank you, Ms. Eggert. Appreciate you sharing your story with us today. That's it. That's all we have for testifiers today. So we can move to member discussion. Members, I will state that we do have several staff representatives, administrative staff. We have House research available to answer questions. We also have representatives from DEED as well as from MMB. So based on your question, if you want to state who you would like to direct your question to, if it's other than the bill author, please do clarify that. So first on my list, I have Representative Nash. Representative Nash, please proceed with your question.
Thank you, Mr. Chair. And my first couple questions will be for the author herself. Representative Richardson, you had stated, and I just wanted to get this one out there, that this is a bipartisan issue. You said that a couple of times. In looking at your authors list, both in the House and then the companion in the Senate, there are no Republican authors. So what did you mean by saying that this was a bipartisan issue?
Representative Richardson.
Mr. Chair, I was referring to the fact that there have been bipartisan bills passed in other states. And when we look at the research that has been done most recently after the COVID pandemic in terms of who supports paid family leave, there is bipartisan support for that as well.
Okay, but not here. Yeah, thank you, Mr. Chair, but just not here in the state of Minnesota or on your bill. Correct?
Representative Richardson.
Mr. Chair, as I stated, the reference to bipartisan was related to bipartisan bills that have passed within other states.
Okay. Thank you, Mr. Chair. And Representative Richardson, question also, when this bill came before us in a previous biennium, there was a conversation, fairly lengthy conversation relative to the software that would be required to track all these things. Can you walk us through what that software is and how it's going to be put together? And if you could just walk us through that, I would be grateful to that, because I do have a couple of questions relative to that.
Representative Richardson. Otherwise, I know if you want to kind of get started on that, we have others that can assist as well.
Yes, Mr. Chair, I will just state in terms of the previous bill that was carried, there were a number of others who helped to support around the IT questions. I know Representative Elkins, we're working together on this as well, and would be happy to have Representative Elkins or the department talk through those things.
Mr. Chair, if I could.
Yes, Representative Nash.
Thank you, Mr. Chair. Well, Representative Richardson, the question it comes back to, it was previously going to be utilizing the UI software. Is that still the direction that you're pursuing with your bill?
Representative Nash, I see Representative Elkins shaking his head in wanting to respond. So I'm going to see if he can.
Well, Mr. Chair, I did have a question. It is directed to the author, Mr. Chair.
Okay, well, slow down. Representative Richardson.
Mr. Chair, yes, the format would be built upon the unemployment insurance format.
Okay, and Mr. Chair and Representative Richardson, to that point, it was previously established both at the admission of the previous author, Representative Halverson, from the past biennium, and then by minute, that the UI software is not one that is just going to be able to be used in its current incarnation, and would require a fairly substantial amount of work to get it to do what it is that you're asking for it to do in this bill. Is that still the understanding that you have of your bill?
Representative Richardson.
Thank you, Mr. Chair. Representative Nash, there will need to be changes to the system, as you mentioned. I will also just add that in terms of looking at the recent changes that the department had to go to related to the pandemic unemployment insurance is another example of, having to be able to be responsive as we have had to be with the COVID pandemic. And in terms of lessons learned, I think that there are a lot of lessons that have been learned from the state of Washington, which this bill has a number of elements that are also based on that bill out of Washington.
Okay, and Mr. Chair.
Representative Nash.
Yeah, thank you, Mr. Chair. And well, Representative Richardson, if you remember, the software that was hopefully being used for the state of Washington wasn't really quite working. And some members on this committee are members, Representative Bonner is a member with me on the Blue Ribbon Commission that the governor set up for IT. And it was decided in the report that was published that software was going to be something that was not a bespoke piece of software or a handmade, tailored, or edited, but it was going to be something that was purchased, not made. So it's the buy versus build mentality. And what you're trying to get done here with at least the software component of this is going to be quite extensive and expensive. and goes against the recommendations of a bipartisan commission to not go down the road of a bespoke software situation. So, and Mr. Chair, I will come back and ask for somebody to address the fiscal costs of that. But my next question is, Representative Richardson,
well, Representative Nash, we've allowed some back and forth here. This is the last one? Because we'd like to get to some other members.
I have plenty of questions, but
okay.
I will make one more question, and then we can come back and I can ask a dozen or so more. But this will be my next. This will be my next question, and then I'll take a breath and we'll come back to some other questions. But
very good.
Thank you, Mr. Chair. So, Representative Richardson, help me understand what is the periodicity? What is the length of time that the premiums are going to have to be collected before they could even begin to get paid out? Because as I remember it from previous incarnations of this bill, it's a very long period of time before the taxes are collected until they could actually begin getting paid out to people. So could you walk us through that, help us understand what is happening with your bill that's perhaps different than the last incarnation?
Representative Richardson.
Thank you, Chair. And just one quick comment before answering that question as well. In terms of what we are trying to do here is to really ensure that families are not put into the position of having to choose between a paycheck and caring for a loved one. So I mean, ultimately, that's at the heart of this. So the way that this bill is crafted, again, it looks similar to the way that the state of Washington organized their program. So after the start, there would be a year and a half delay of collecting premiums before we would begin to look at building out, paying out benefits. The idea is to really focus on creating a solvent plan. So that would result in a delay before premiums would be collected. And I think that the learnings of what we saw within the state of Washington, that delay was really important because when the Washington plan went into effect, it happens to be right in January 2020, and they were faced right away with the COVID pandemic. But even with being faced with the pandemic and being faced with increased use of the program as a result of the pandemic, that's a situation that because they spent some time building up the solvency of the fund, that they're going to be able to keep their premium rates flat for 2021.
Thank you,
Mr. Chair, just real quick.
One quick follow-up, Representative Nash. We do need to get to some other members. We'll put you back at the bottom of the list, I promise.
I do understand. So you're going to have a year and a half of collection before you're solvent. Is the software creation editing going to be longer or shorter than that period of time? And then I'll be done, Mr. Chair.
Thank you. Representative Richardson.
Representative Nash, in terms of looking at the software pieces, there are conversations that are happening right now with the departments around timing. But again, in terms of what the lessons that we have been able to learn from other states, what is currently within the bill now reflects what happened in Washington, and they were able to complete that project on time.
Thank you, Representative Richardson. Next I have on my list is Representative Elkins. Representative Elkins, please proceed.
Thank you, Mr. Chair. So I know we have Darielle Dannen from DEED is on the call. And so I think it would be good to have her address the project timelines for the project in terms of the general approach. I would first of all say that since we last heard this bill 2 years ago, DEED has had a major upgrade of the current unemployment insurance system, and as a result of those upgrades, the DEED Minute team feels comfortable that they can take a clone of that system, basically, because under federal law, you can't commingle UI with anything else. But the current UI system is suitable to be cloned and then modified to run this program on it. The modifications are reasonable. This is an approach to development that I have taken myself in my career as a solution architect. I know that the team has already reached out to the Deloitte team that built the Washington system from scratch. This is not going to be built from scratch. We're taking an existing software platform and modifying it to adapt it from unemployment insurance to paid family medical leave. We'll have Ms. Dannen discuss this in more detail, but I have met with them, and I feel comfortable with the approach that they've laid out. They're doing their homework. Have reached out to the Deloitte team that built the Washington system from scratch, so they've been able to take lessons learned from that Washington team. And I'll let Ms. Dannen continue, but at this point I feel comfortable that they should be able to complete this project on time and within the budget that they've laid out. So Ms. Dannen, if you can address that, that would be great.
Thank you, Representative Elkins. Ms. Dannen, I believe you're on the call. If you want to speak more to that, that would be appreciated.
Thank you, Representative. So hi, my name is Darielle Dannen. I'm the Government Relations Director at DEED. I'm happy to chat about some of the build out and some of the IT work that we've done here. Let's see. It might even be, well, I'll give a little basic overview and then happy to answer questions. I will just say that, of course, we all know, I think that our friends at Minute will obviously be very involved in this process as well. So I'm not going to hold myself out to be an IT expert by any means. I think actually Representative Elkins is being modest and he probably understands more about IT and the IT build on this than I do, but happy to chat about it a little bit. We did have our team go out to Washington State, as I think the chief author of this bill referenced, and meet with the team there. And our IT team at Minute has also reached out to both Washington State and a number of other states to get a sense of really that build time, and also to get a better sense of, I think, as Representative Nash was pointing out, some of the recommendations from the Blue Ribbon Council about not building everything from scratch, but instead potentially using components that other seats are utilizing, or of course, as folks here have referenced, utilizing some of the components from our existing unemployment insurance system as well. So obviously that's a very high level summary there, but certainly that's the trajectory that folks are thinking about here of kind of heading into this work. We do have the work budgeted out over actually a somewhat significant amount of time. We would start bringing staff on in fiscal year 22 and staff that up more significantly over fiscal years 23 and 24, and then start reducing our staffing components sort of in those other years. And of course, as one would with any IT system, we would expect that we would have some IT staff dedicated to this process and this program kind of over the long term. So I think I'm happy to answer questions. Maybe that's enough overview for now, and then I can pause, and I'll be here for the duration. So happy to answer questions.
Thank you, Ms. Dannen. We appreciate you being with us today.
Brian
Elkins, did you have a follow-up question?
Just real quick, the Chief Business Technology Officer for DEED at Minute, Brian Alley, has been involved in the discussions that I've been involved in as well. And he would second what Darielle just told us if he were here today. I was hoping he would be here today, but I don't see him on the call.
Okay, all right. Thank you, Representative Elkins. Next, I have Representative Klevorn. You're next on my list. Please proceed with your question.
Thank you, Mr. Chair. And I have two questions. I can ask one and then a follow-up and then come back to the next if you want. Just let me know how you want me to proceed. The first question I have tonight is, I heard Ms. Davenport mention in her testimony tonight that she was relying on FMLA. And I'm just wondering if you could please discuss the difference between paid family medical leave and FMLA. And Representative Richardson, I would ask you to determine who might be best on your team to answer this question. Thank you.
Representative Richardson, do you have a testifier, or would you like to speak to it?
Thank you, Mr. Chair. I will maybe begin and turn it over to Ms. Fitzpatrick. But, you know, in terms of thinking about family medical leave, that is not necessarily a paid, that's not a paid leave. And so that is one of the biggest differences between the programs. And Ms. Fitzpatrick, I don't know if there's additional information that you'd like to add.
Ms. Fitzpatrick.
Thank you, Chair, members of the committee. Yes, I think besides the paid element, there are a few different kinds of leave that we are addressing in this particular bill, safety leave being the major one. And then the other piece I would say is that about 55% of workers are currently covered under the FMLA protections, and our bill would cover many more workers as part of this program.
Okay. Mr. Chair, may I ask my second question then?
Okay. Go ahead, Representative Klevorn.
All right, thank you. Because I think these differences are really important, especially given the constraints that FMLA has, and then this policy as well. When I was listening to Ms. Byrne discuss the very painful issues that she experienced, and I'm very sorry to hear about the death of your mother. I know how difficult that is. She made me think about what our families are going through today. We are both in a global pandemic, and we are in an economic downturn. And we have many, many Minnesotans who are sick, and then we have many of those who cannot take time off. How will this policy really help our families deal with this situation that we're facing today? I think it's a very critical question that needs to be answered. Thank you.
So, Representative Klevorn, were you directing a question towards a particular testifier or back to the bill author?
I would always say to the bill author, and then she can decide who she would like to best address.
Very good. Representative Richardson.
Thank you, Mr. Chair, and Representative Klevorn. I think that you raise a really important question, especially as it relates to equity, because I think what we have to talk about right now is who has access to paid leave and who doesn't. And so when you begin to, to look across the data, we definitely see disparities in terms of access, be that racial disparities or gender disparities as well. And right now, within the context of the COVID pandemic, two of the demographics that have been hit the hardest within our state are women workers and also Black workers in Minnesota when we look at the data. And so being able to have access to paid family leave and having what amounts to, in essence, a universal program for Minnesota workers is really, I think, an important step to beginning to address like the deepened disparities that we see as a result of the COVID pandemic and an economic downturn as well. And I don't know if Ms. Fitzpatrick has more that she'd like to add related to that question.
Ms. Fitzpatrick?
No, I think you did a great job.
All right. Okay. Thank you all. Next on my list, I have Representative Drazkowski.
Thank you, Mr. Chair. Thank you, Representative Richardson, for bringing your bill. Congratulations, Representative Richardson. You brought a very progressive bill. It's been said that progressivism is the front door to communism, and I think this heads in.
Representative Drazkowski.
Mr. Chair?
Yes, please proceed.
Do I have the floor, Mr. Chair?
Please proceed, Representative Drazkowski.
Thank you, Mr. Chair. And this bill certainly accomplishes that. It takes over a large share of the private sector and business and has government take that away from them. And not only the decisions, but in this case, what appears to be billions of dollars of money as well. I'm curious, Mr. Chair, and the author, Representative Richardson, is there a fiscal note for this bill? I looked through the notes, I didn't see it. I'm wondering how big I'm trying to remember from 2 years ago, Mr. Chair and Representative Richardson, how big is the slush fund that is built up over the first year or two of accumulation with this bill?
Representative Richardson.
Thank you, Mr. Chair, and Representative Drazkowski for your question as well. I think that it is really clear within the context of the pandemic that we are in. There are lots of people who have needed help. Be it through the payroll protection programs or be it through paid leave. And this is really about ensuring that families have access to be able to not be forced to choose between, having a paycheck and being able to care for themselves or a loved one. You are correct. There is the fiscal note is still being prepared at this time, and so that will be coming within the future. Within Article 3 of the bill, it does lay out a number of the appropriations that are pretty similar to the last bill as well. Within looking at fiscal year 2020, there's an initial investment that would be paid in. The thought process would be that those funds would be returned to the general fund once the program is solvent. And as Ms. Fitzpatrick talked through as well, there are several appropriations that would relate back to the actual premiums that would need to be paid. And I think it's also important to note that within this bill, there is nothing that requires that a business would have to pay in to this particular fund. They could choose and elect to have their own paid family medical leave program.
Representative Drazkowski, do you have a follow-up?
Thank you. I've got several questions, Mr. Chair. Thank you, Representative Richardson. So do we know how much money this bill is going to extract from private sector employers and employees for the first 2 years and stack into a slush fund largely unspent on benefits during that time? I do remember the bill from the floor discussion last time, and that was very clear to me, both in Ways and Means and on the floor last time, Mr. Chair and Representative Richardson. Do we know how much that is?
Representative Richardson.
Thank you, Mr. Chair. Representative Drazkowski, in terms of what that would look like, it would depend on the number of businesses that would opt in to participating within the program. Again, they would have the option to opt in or to provide a comparable program. When we're looking at what those premiums would look like, as Ms. Fitzpatrick laid out earlier, if you're looking at someone with a salary of about $50,000 a year, that could translate into a premium of $6. $3 of that could be attributed to an employee, and the other $3 to an employer.
So, Mr. Chair, and,
yes,
and Representative Richardson, I mean, so you don't know, we don't know, no one knows how much money this bill is going to extract from workers and employers over the next 2 years before anything is even spent on benefits. I do remember a figure in my head. I don't even want to guess if it's correct. So I would ask Mr. Chair, what is the plans for this bill? Is this going to be laid over until we can actually see a fiscal note for the bill, this being the Finance Committee?
Representative Drazkowski, no. I plan to take a vote on this bill at 6:25, which is in about 25 minutes from now, and we will be referring this bill to the Commerce Department.
So Mr. Chair, we're going to forward the bill, the major Finance Committee that is tasked with reviewing the financial components of this bill, and we're going to pass this bill without even knowing the financial impact of the bill. Not a good decision, Mr. Chair, not the way I would suspect you really want to run the House. But I have two other questions for the author, Mr. Chair.
Okay, Representative Drazkowski, if it's along these same lines, please proceed. But I do have other members that would like to ask questions as well. So if they're related to the subject matter, please continue with your line of questioning.
Yes, it's, yeah, I ran into a dead end and we didn't get any answers about the huge fiscal impact that this is going to create. But I'm curious about some specifics, Representative Richardson, on page 9 of the bill. It defines employer, and there's definition of all employers in here. Two questions related to that. Unless government entity, I don't know what that means. And then secondly, it seems to be missing schools from there. Is there a reason schools is not specifically stated? Oh, I'm sorry. Statewide system was the one I didn't understand on line 9.27. But then school seems to be missing from a definition of employer. I think that was your intent, and that was the I know that was in the bill last time in the discussion of some opposition to the bill earlier. So I'm curious about those. And then I have one question.
Okay, hold on there. Let's let Representative Richardson address that one first. Representative Richardson.
Thank you, Mr. Chair. And Mr. Chair, I would ask Deb Fitzpatrick. She talked a little bit about the definitions of employee and employer.
Sounds good. Ms. Fitzpatrick, could you speak to the question?
Yes, and I could also refer to counsel who helped with this. We are picking up this definition of employer or employee from Washington State, again, to kind of be able to take advantage of the systems that they've developed there. I do believe that the intention was to include schools, and you're looking at line 9. Sorry, just line.
Drazkowski?
Page 9, generally, line 9.23 through 10.2.
Yes, so I believe that the that was the intention. Maybe we could ask counsel to take a look at that and see if there was some piece of this that we missed in the drafting.
Do we know what stateside system means?
Okay, hold on, slow down.
Statewide system.
Let's please ask our questions to the chair. We have one question before us right now. If you want to refer that to House Research for an answer, we can do so.
We could do that, but I imagine that might be something like the MinSCU system or something of that nature.
So Mr. Chair.
Representative Drazkowski.
Thank you. Well, I appreciate that. It sounds like most of the bill, if not all of it, came from Washington State, and we don't know what the definitions even are. I think, Mr. Chair, this bill, the author and the people supporting her don't even know the content of the bill and what they mean or why things are missing. So I find that to be problematic as we think about moving this bill to the next committee. But Mr. Chair, my next and last question was on line 17.3 and through 17.5, and I would ask the author, why are we exempting payments that were made to largely musicians, radio, television, similar artists in production of television commercials, musical jingles, radio spot transcripts, and spot announcements? Why are they exempted from the collection of taxes under this particular bill?
Representative Richardson.
Thank you, Mr. Chair, and thank you, Representative Drazkowski, for your question as well. And, as mentioned before, the language is really based on some lessons that have been learned from Washington and other states that have gone before us within doing this work, and that is another example of language that we have pulled from the Washington piece. And with the decision to take some of the lessons learned from other states, it's really been around looking at building a program that is going to be sustainable.
Thank you, Representative Richardson.
So, Mr. Chair, I'm done, Mr. Chair, but we have a bill before us that came from Washington State. It looks like it's been simply put into the reviser's machine and then spit out before committee here. We don't have a fiscal note. We don't know what it's going to cost. We don't know what many of the elements of the bill are. Mr. Chair, the thing to do with this bill is to lay it over. Otherwise, we're not acting responsibly as the Finance Committee. It's supposed to really look through this bill. Thank you, Mr. Chair.
Thank you, Representative Drazkowski. Members, we have about 20 minutes left before we move to a vote. We have numerous members that would still like to ask some questions. So if we can be succinct with our line of questioning and allow ourselves each just one follow-up question, that would all be appreciated so everybody can get their questions answered. Next, I have Representative Greenman.
Thank you, Mr. Chair. And I would just ask, I have a quick bit of a clarification question from Representative Drazkowski's questions that I'd like to ask before I get into my question. Representative Richardson, I really appreciate you bringing this bill. And I have heard, I think from Representative Nash and others, the amount of work that's gone into it over the years and this year. And so I think sort of the characterization, being new to this place, the characterization that it was both deep in and lots of people were in it and also just exported from Washington State feels inconsistent. But from what just a few questions, this works a lot like the way that unemployment insurance works, the fund and everything. Is that right?
Representative Richardson.
Sorry, Mr. Chair, that is correct, Representative Greenman. It is built upon the UI work and also many of the definitions are related to the state of Minnesota definitions as well, correct?
Representative Greenman.
Thank you, Mr. Chair. So when I think about unemployment benefits, I don't think about communism and a slush fund. So I just wanted to make sure that we're sort of thinking about the right model. But I actually did not come to this committee meeting expecting to tell a story, but I really appreciate and want to lift up the stories because I think probably most people have one. And as I was thinking about this bill, when I was 29, my dad was facing multiple myeloma, which was a very aggressive cancer. My dad was in Mayo for a long time, and my sister was a nurse at that time, an RN. And I remember the moment of sitting at a Perkins in Rochester and having Annie ask the question, so I have this much PTO left, I have this much, and then I can take this much FMLA. I was in law school, so I was out of state, and we were trying to figure out how to be there for my dad, who was dying, and having to have that conversation. And I can't imagine what it's like for families in all of these different ways to be able to make those tough choices. And when I was talking to my sister, because I just wanted to make sure that she remembered that conversation too, I sort of asked, what did you end up doing? What did we do? And she took the time, she maxed out all of her PTO, she took FMLA, and I asked how it affected her budget because she was 26 and a new nurse. And she said my dad helped her pay for some of it. And I don't know what I would have done if I didn't have that help. And I don't know what people can do when they don't to make that choice. And so from that sort of, what I want to ask you, Representative Richardson, is, from my sister's story and the questions she had for me coming into this hearing are, we know that access to this isn't distributed equally. And so I'm interested in the families that don't have that support, who has access now, and how would this impact what we have heard from all of these committees, which is the disparities in our workforce and then our and jobs, and particularly thinking about both income and racial disparities. I'd love to hear what your thoughts on that.
Representative Richardson.
Thank you, Mr. Chair, and thank you, Representative Greenman, for your question. And what what some of the data tells us. Even looking at particularly like with low-income workers, if we look at the Department of Labor data, it says that most people, or 25% of folks, are going back to work within 2 weeks of giving birth. So that gives you sort of a spotlight for many low-income workers in terms of being able to have not only sufficient time for child bonding, but also for sufficient time after giving birth to be able to recover. We heard from a testifier today that talked about his wife having a C-section, and think about having to return back to work within 2 weeks after a major surgery like that. When we think through where we tend to see disparities in terms of access, it is definitely going to be among some of the lowest income workers within Minnesota. And there is also going to be disparities in terms of gender for women, and also racial disparities in terms of who has access. So a huge component of this bill is about equity, and it's about ensuring that there's equitable access. And the disparities that we see today really build on a legacy of disparities that we have seen not only in Minnesota, but within the state as well. Because if we take some time to even track the history of our Social Security program, for example, you look at the history of like who was left out of Social Security in the very beginning, 60% of Black workers, because there were decisions made to exclude farmers and also to exclude domestics. So the disparities that we see today are pretty similar as well in terms of as we think of who would have access to this type of leave.
Thank you, Representative Richardson. And members, again, just a reminder, we've got about 15 more minutes for questions. I've got 4 or 5 members. I want to allow Representative Nash a chance to be the closer in terms of questions, but also want to allow adequate time for Representative Richardson to make some closing comments. So Representative Bonner, if you could please be succinct with your questions, that would be appreciated.
I will do my best. First, a couple quick comments and a question. The first, I just wanted to say thank you to the bill author for bringing this forward. And I really appreciate that we do have that period in the beginning to build up those funds so that they're self-sustaining. I think that's the financially responsible thing to do. And I really appreciate that attention to detail for the budget. Second, everyone here knows I'm a big process improvement person, always have been. And I really appreciate the fact that we've done a lot of work over the years in terms of working through the discovery of that feedback loop, the lessons learned from various states around the nation, including Washington among them, to really get a sense of what that would look like, and especially when it comes to our IT systems. And of course, yes, we do have some blue ribbon council members on this committee. And certainly I hope and would like to believe that myself, Representative Elkins, and even Representative Nash would love to be a part of the conversation in helping shape and guide the future of what that could look like and making the best possible decisions for that. But here's my question. So we know that caring for elderly parents is extremely expensive. Assisted living, nursing home care, that kind of thing. When my 85-year-old grandmother, who by the way ran the entire flight kitchen at Northwest Airlines, started to have some real challenges, our family had to come down to a decision on how we were going to do that, right? And grandma really didn't want to go into care. And my mother's solution ultimately was to leave the workforce. And I know a lot of other women and families who are in this position. But I'm wondering if we have this coverage so that people can take time out to maybe deal with some of those issues rather than the assisted living or the nursing home care. I'm curious about the differential in what that might look like. Rather than going to really expensive home or expensive care, having people be able to instead use this program to help care for those loved ones. If someone might be able to speak to that.
Okay, Representative Richardson. There are a couple of questions in there. You kind of snuck those in there, Representative Bonner, but we'll let it slide this time. Representative Richardson, you want to speak to that?
Thank you, Mr. Chair, and thank you, Representative Bonner. I think, what you're really getting at is one of the primary reasons that paid family leave can be so helpful in retaining the workforce. And I think that is not only thinking about it from the perspective of caring for elderly parents, but also thinking about it from the perspective of bonding with a new child as well. Because, what the research tells us is when people have the opportunity to take paid family or medical leave, that tends to have them be able to stay within the workforce longer as well. And I don't know if Ms. Fitzpatrick would have anything to add on to that.
Ms. Fitzpatrick, a quick response.
Sure, really quickly, Mr. Chair, members of the committee, there is definitely a very robust research base that shows that these types of programs do reduce the need for nursing homes, that they do reduce preterm births and a whole host of other health outcomes that do actually save families money, but also the state money in the long run. So it is an investment that not only helps people, but could also help the bottom line of the state.
Thank you. All right, members, again, just to kind of recap, I still have 5 members that would like to ask questions. If it hasn't been asked yet, we can continue on, but I definitely want to allow for Representative Nash to be the closer in terms of questioning and allow for Representative Richardson to make some final remarks. Next on my list, Representative Mason, if you could please be succinct with your question.
Chair. I'm going to change what I was going to say. I did have a question, but I just want to say when I ran for public office, it was because I thought I could help people. That to me is my priority, is to do the best I can to help our people. And I'm hearing some comments today that I find incredibly offensive and certainly not sharing that priority. It's more about money. And the thought is, and we've heard some stories about people who've had children and did not have somebody to help them. I mean, I cannot tell you how vulnerable somebody has to be in a position like that and not have somebody understand that it is a problem that we have the ability to solve. And the other thing I'm going to throw in, I remember some friends of mine had gone over to one of the Scandinavian countries, and they said, it is remarkable how much happier their younger people are. I mean, we have burdened our families with so much. And for our legislators, all of our legislators, not to understand that, to me is beyond comprehension. So if the author wants to again say exactly how this will help people that normally are without help, without support, that might be helpful.
Thank you, Representative Mason. I can feel your passion for this bill. Representative Richardson, a quick response to Representative Mason.
Thank you, Mr. Chair, and thank you, Representative Mason, for your question as well. And that's, at the heart of this, that's what this bill is about. It's about supporting families. It's about helping families. And within what the research shows us is, states that have paid family leave bills, the benefits don't just flow to the families as well. They flow to the state and to employers as well. And so with what we know on the research and what we are seeing on the reports, employers are able to retain more employees. Families are able to care for their families better, and present employees help to, they're the backbone of our businesses, both small and large.
Thank you. Representative Quam, it's your lucky day. I'm bumping you up on the list. Representative Quam.
Thank you, Mr. Chair. And I share the intent that's been spoken about. But being a person that worries about implementation, having experienced all the issues that we've had with updating, software, not having the budget numbers, and then having a lot of, we're not sure because we're trying to borrow it from another state where underlying laws may be present there and not here. I am just concerned if we're going to do something, we need to have it done right, prepared, and I don't think we're quite there yet. And so I would move to table this bill and would ask for a roll.
Representative Quam asks for a roll call on tabling the bill. Do we want to take that now? Or do
Mr.
I
Chair,
wait?
that's why I waited to raise my hand.
Okay, very good. Well, let's take the roll on tabling the bill. Would Ms. Spreck please take the roll?
Vice Chair Carlson.
No.
Representative Nelson.
No.
Representative Nash.
Yes.
Representative Bonner.
No.
Representative Drazkowski.
Aye.
Representative Elkins.
No.
Representative Greenman. Representative Greenman.
She's on mute.
You're muted. I'll come back to you. Representative Klevorn.
No.
Representative Koznick.
Aye.
Representative Mason.
No.
Representative New Brindley.
Yes.
Representative Pulaski.
Pulowski, no.
Representative Quam.
Yes.
Representative Greenman.
No.
With a vote of 8 nays and 5 ayes, the motion does not prevail.
Thank you, Ms. Spreck. Next on my list, I have Representative Klevorn. You've got a minute and a half, if you could please be succinct. And then Representative Nash, you're on deck.
Thank you, Mr. Chair. I just wanted to make sure, earlier this morning when we were discussing the other bill, I talked about the false choice between either funding our schools or supporting legislation. And I want to say that that is a false choice in this conversation as well. Funding our schools is an entirely separate conversation to funding paid family medical leave. And the question that I have that I would like to bring to Representative Richardson is this. While we do not have the fiscal note, and I understand that that is an important piece of our work, we will in fact have an opportunity as legislators to vote one more time where we will have that fiscal note available to us. Is that correct?
Representative Richardson.
Mr. Chair, yes, that is correct. Like other legislation, it will move through the committee process. We have other committee stops before we get to the floor.
Representative Klevorn.
I'm concise, Mr. Chair. That's it.
Thank you, much appreciated. Representative Nash, closing comments?
Yeah, no questions, but comments. To the last comment about it's okay if we move this out of committee, even though we don't have the fiscal note. No, it's not. This is a finance committee where we are talking about important things that the state is going to have to pay for. And to say that it's okay to move a bill on before we even understand what the totality of the cost is reckless and irresponsible. I want to point out a couple of things. Please, for anybody who was watching earlier and may have left in the middle, this is not bipartisan, even though Representative Richardson would have you believe that it's a bipartisan effort. It's not. You heard from the school boards tonight, and there's a letter from the League of Minnesota Cities talking about the fact that there are giant looming questions over this. Both the school board and the cities will tell you that this is effectively an unfunded mandate. Unfunded mandates that get pressed down to lower units of government get paid for through general fund appropriations, which means that they come out of a levy. As a former mayor, I will tell you that is the only way they get paid. So by passing this bill, you are saying it's okay to raise taxes on people who live in cities that all of us represent. Also reckless. And I want to be concise and finish here to say, Representative Richardson and those of you that are supporting this, I would challenge you to pull out your Chamber of Commerce directory for your local area and walk up and down Main Street, wherever you might happen to live, knock on the door, talk to the business owner, and share the fiscal note, share the implications, share the costs, share everything that's going to go into this. Look them in the eye and ask them, is this something that you are in support of? Because they're all trying to take care of their employees, but this is a humongous cost that small businesses are going to have to absorb. This is a humongous cost that is going to go really into the wallets of all of those people who are struggling to stay afloat. This is going to go to school boards and city councils. I would ask you to set up meetings with them too and say, do you have the ability to pass another levy to pay for this? Because my guess is, if you look at the history of levies for schools, it's not always easy to get that done. And I'm just going to say again, the fact that we don't have a fiscal note and that we're passing this out of committee is I'm just gobsmacked. This is not a good process. You should have the fiscal note so that we can talk about concrete numbers in this committee of jurisdiction. I would encourage your no vote for that reason alone, that you are about to cast your vote and say, I'm okay with effectively writing an open-ended check. It's just fine. I'm not okay with that, and I would urge your no vote. Thank you, Mr. Chair.
Representative Richardson, closing comments.
Thank you, Mr. Chair. And I know that we are tight on time here, so I will strive to be concise as well. You know, what we are really talking about here is a matter of equity. It's a matter of ensuring that families are not being, again, placed in those really difficult decisions. And what we have learned from the COVID pandemic is that there are lots of pieces that work together to ensure that our economy works. When schools were closed and when daycares were closed, that had a huge impact. And so being able to ensure that families have access to paid family medical leave, again, has benefits not only for the family being able to care for themselves and for their loved ones, but it also impacts the costs that we know occur within the state as well. Because when families don't have a safety net, where those costs are born, they're born in our communities, they're born in our counties, and they're born on our state. In terms of thinking through what happens when someone can't go back to work because they are ill, or they can't go back to work because they're caring for a child. Those are all things that are going to have bottom line impacts on our systems, and they're going to stress our systems as well. And so this is about ensuring that we're providing a safety net for families, just the same way that we provided a safety net for businesses faced with the COVID pandemic, the billions of dollars that went out for payroll protection loans. Those are things that we did in order to ensure that our businesses survive, and families deserve the same type of support to ensure that they're able to care for their families and themselves as well. And I would ask for support, Mr. Chair.
Thank you, Representative Richardson, and thank you to your testifiers, and all the testifiers that were here today, taking time to be with us in this later hour. With that, I will renew my motion to refer House File 1200 as amended to the Commerce Committee. If the committee legislative assistant would please take the roll.
Vice Chair Carlson,
Yes.
Chair Nelson,
Yes.
Representative Nash,
No.
Representative Bonner,
Yes.
Representative Drazkowski,
No.
Yes.
Representative Elkins,
Aye.
Representative Greenman,
Aye.
Representative Klevorn,
Aye.
Representative Kosnick,
No.
Representative Mason,
Aye.
Representative New Brindley,
No.
Representative Pulowski,
Pulowski, no.
Representative Quam,
No.
with a vote of 7 ayes and 6 nays, the motion prevails.
Thank you, Ms. Breck. Members, before we adjourn, our next meeting is on Thursday, March 4th, 8:30. We've got a couple bills set on the agenda, so I'll look forward to seeing you all then. And with that, members, we are adjourned.